Hi everyone, my name is Sang Lee. I'm still working on pediatric. This is my case presentation of a SOAP. BC is a 5 years old Hispanic female. She was brought into clinic by her mother for annual checkup and then constant coughing from the last week. The mother reported that the symptoms did start last month by coughing, wheezing, and then shortness of breath more than 4 times a week. She wakes up at night by the symptoms. The symptoms got worse as temperature was down. No known history of allergy or allergic rhinitis. The annual checkup was completed in 2021. The developmental and milestone was delayed. She did not receive flu vaccine nor COVID-19 vaccine yet. Birth history. Mother was 27 years old, 37 weeks gestational, vaginal birth. Birth weight is 5.8 pounds. Height was 18 inches. The past medical history, frequent otitis media, developmental disorder of speech and language, neurofibromatosis, and underweight, congenital and the developmental myasthenia, and the congenital hypotonia, failure to thrive. No past surgical history. She is not taking any medication, but only Tylenol 5 mL PRN for fever and body aching. No known allergies. Immunization is up to date. Social history. She lives with a parent and her sister. Her family has 2 dogs and 1 cat at home. They mostly stay inside home. Her father smokes half pack of cigarette every day. There are carpet in the bedroom. Family history. Father has diabetes and the mother has asthma. Review system. General. The mom denies fever, chills, and sweating. Denies neck pain. Denies eye discharge. No ear pain. No sore throat, but admit recurrent congestion, nasal congestion. Cardiovascular, admit shortness of breath, but denies chest pain. Lungs, admit coughing and wheezing. Denies GI, mom denies vomiting and diarrhea, but admit constipation, poor appetite, and picky eating. Vital signs. Temperature 96.8 Fahrenheit. Heart rate is 120. Respiration is 25. Blood pressure is 109/77. Water saturation is 92%. Room air. Height is 36 inches. Percentile is 2%. And then weight is 26 pounds. Percentile is 5%. She is extremely underweight. And the BMI is 14.1. Physical exam shows general, undernourished, but well hydrated, and then slightly respiratory distress. Eyes, sclera white, conjunctiva clear, and then ears, tympanic membranes translucent, canal wall pink without discharge, nose, mucosa and then turbinates pink and bulging, nares patent. Neck is a full of range of motion, the trachea midline position, no thyromegaly. Lungs, no use of accessory muscle, but wheezing escalated on expiration and then inspiration. Heart, regular heart rhythm, no murmur, no rubs, no gallops. Musculoskeleton, digits without clubbings or cyanosis. Lab shows hemoglobin is 11.4. Based on the lab and the physical exam and then past medical history and the family history and the presenting symptoms, my assessment is first, wellness visit, and the second is asthma, mild intermittent, and then third is underweight. So my treatment plan is, so diagnostic test for asthma is not available for the patient. So it is important to discuss the result of physical exam and diagnosis. And also important to discuss the nutritional counseling about constipation, poor appetite, and the picky eating, because she is extremely underweight. Also, treatment plan is going to be immunization, flu vaccine, and the COVID-19 vaccine. She is 5 years old. She is eligible for COVID-19 vaccination. So 2 vaccines are very important for respiratory complications, prevention. So medication, the asthma treatment, mild and moderate, albuterol inhaler 1.25 milligram, 2 puffs as needed, and then Symbicort 80 over 4.5 micromilligram twice a daily. And then education, it is important to avoid triggers and irritants such as smoking, pet. Also clean the carpet as often as possible to prevent the asthma, the symptoms. It is also important to educate to take medication as prescribed, and then also explain the medication side effect. Also, it's important to educate how to use albuterol, the puffs for rescue for asthma attacks, and then inhaled corticosteroid use. Also talking about the nutritional counseling. So it is important to keep a meal and a snack schedule every 2 or 3 hours so that she is hungry for meals. So for the older children, dietary energy intake can be increased by adding cheese, butter, or the sour cream to vegetables, or by using calorie-enriched milk drink instead of whole milk. Referral. At this time, referral is not required, but if the asthma gets, the symptoms get worse or acute episode, do not respond to the medication enough within the 1 or 2 hours, educate the patient or just mom to go to the ER or hospitalization. In this case, a referral is necessary to an asthma specialist. So follow up, continue to follow up with neurology, GI, and the ophthalmologist, and then ENT specialist for just regular checkup. And that the patient return to the clinic in 2 weeks if the asthma symptoms do not improve. So this is my case presentation. Thank you so much for watching.